Today I'd like to talk about the advancement of technology in the medical space and how it's helping us practice medicine better as well as perform better, more accurate surgery. There are three specific technologies that are entering our space that I think are noteworthy and are three technologies that I'm currently working with industry in order to help develop and help bring to our field. These technologies include augmented reality, virtual reality, and artificial intelligence. Everybody's heard of artificial intelligence, and a lot of people know about virtual reality when we talk about the 3D goggles that you can put on and play video games. Well, the good news is that technology is now applicable to the medical space, and we can actually use those goggles and that technology to plan our surgeries. We have a specific case which was very interesting in which we use this technology and we're able to plan the surgery in virtual reality and then actually perform the surgery using augmented reality. This is a very interesting case of a young female who sustained an injury to her face and skull after being hit with a baseball to her right eye. Unfortunately, she sustained an orbital fracture, which is fracturing of the bones around the eye. She sustained a nasal fracture or a broken nose, and she sustained a soft tissue injury, which consisted of a large cut all the way down to the bone across her forehead, eyebrow, and nose. You'll see in some of the pictures that we're going to show kind of where she started and how we got her to be reconstructed back to normal. This was a long process actually and required more than one surgery, but with the help of augmented reality and virtual reality, we were able to get her back to her normal self in one of the most precise and accurate manners possible. We can see our young patient before surgery and directly after her injury. She has a large laceration, essentially a cut all the way down to the bone over her right eye, and that cut extends to her nose. You can also see that her eye is very bruised and swollen, and her eyelids are actually swollen shut. You can't notice on this picture, but her nose is actually broken and shifted to the left. This patient's surgery required two separate surgeries because at initial injury, she had so much swelling around her eye that any repair around the eye could put undue pressure on the eyeball itself. As such, in her first surgery, we were concentrating on fixing her soft tissue, putting her skin around her eyebrow back together and trying to prevent any scarring, and we also wanted to reset her nose on this first surgery. We plan to come back and fix the eye socket at a later date if needed once the swelling around the eye had come down. After a few months following the initial surgery, the patient did have what we predicted could happen, and her eye socket on the right side showed what we call volume loss, and her eye was widened. In this image, you can see the state of her right eye before surgery. You can see how asymmetric that is compared to the other side. And given the complexity of the reconstruction around that eye, we wanted to plan her surgery very meticulously, and we used virtual reality to do this, with the hopes that we could use augmented reality in surgery to perform the surgery accurately. In this video, you can see us in the planning stages of the virtual reality portion of the procedure. I'm in the lab with the virtual reality goggles on. We're planning surgery on the larger monitors in front of me. However, I can't see these monitors, only my team can because I have the virtual reality goggles on and I'm planning her surgery in three-dimensional space. So in this planning video, we see the three-dimensional structure of the patient externally. We then can peel away the skin in virtual reality and visualize only her bony structures or her skull or skeleton. We can map out her nerves. You can see here we mapped out one of her nerves in blue here so that we can find this nerve very easily during surgery and protect it. You can see that we can visualize the skull from all areas, even from inside the brain cavity looking out, without being invasive to the patient. This is the beauty of this technology where we can get three-dimensional renderings and three-dimensional planning, even though in real life we cannot get three-dimensional access to areas in the human body. We can see here that we've designed an implant to fix her fracture at the bottom of her right orbit, and that implant we can toggle in and out in virtual reality to make sure we like the placement and we like the shape. We also want to make sure it does not affect where the nerve sits, and we want to make sure that it does not impinge the nerves at any level. This again is one of the beauties of virtual reality, where all planning can be done for the safety of the patient, and it can be done precisely prior to surgery so that less planning and fine-tuning have to be done during the surgery itself. Now we can peel or put the soft tissue back on the skull, and this would effectively be the patient post-operatively. You can see that we've got a pre-made skull and a pre-made implant for the patient. And this pre-made implant is 3D printed and can fit into a skull that has been specifically designed for her. Intraoperatively, we can see that both myself and my assistant are able to map in real time exactly where the implant should go based on our virtual reality planning. We can see where we are in three-dimensional space with the 3D renderings on the screen, as well as 2D renderings off to the left of the 3D screen. This helps us locate the critical anatomy and helps us confirm placement of the implant and preservation of the tissue and nerves that we need to keep safe during the surgery. This, again, is the augmented reality, where we've used virtual reality to plan previously, and now we're using augmented reality in real life while we're operating on the patient. After doing this complex reconstruction, we can see that the patient's eye socket is now no longer sunken in. This patient has some natural facial asymmetry, so her eye is naturally higher on the right than her left. However, you can see that the sunken in volume loss that she suffered before surgery, as well as the double vision she suffered before surgery, have now resolved, and she's back to her normal self and very happy. What you've just witnessed is how virtual reality and augmented reality can help in a reconstructive facial surgery case. I'm working with industry currently to help bring this technology to the forefront of what we do in reconstructive surgery, and hopefully expand it to applications that will involve aesthetic or cosmetic surgery as well. This, along with artificial intelligence, with which our practice is also working with, will hopefully change what we do and make surgery quicker, safer, more accurate, and with the best results we've ever seen. I'm Dr. Alexis Furze, facial plastics and reconstructive surgeon, nasal and sinus surgeon.